Hello everyone, this is Dr. Ankita Singh, Reader, Department of Oral Pathology and Microbiology, Babu Banarsidass College of Dental Sciences, Lucknow. Today's lecture is on benign connective tissue tumor, fibroma. What is oral fibroma? It is also called irritation fibroma, traumatic fibroma, focal fibrous hyperplasia, or fibrous nodule. It is most common benign soft tissue neoplasm. It is a reactive hyperplasia of fibrous connective tissue in response to local irritation or trauma. So we can see a picture which shows a pink nodule of posterior buccal mucosa near the level of the occlusion plane. It's present over here. Clinical features. It occurs at any age, but mostly third, fourth, and fifth decade of life. Females are affected more. Occur at any oral site, but most commonly buccal mucosa along plane of occlusion. Other sites are gingiva, buccal mucosa, tongue, lips, and palate. So it appears as elevated smooth surface pink nodule that is similar in color to the surrounding mucosa and a sessile and occasionally pedunculated base. In black patients, mass may demonstrate gray-brown pigmentation. It can be small to several centimeter. Sometimes tumor is irritated and inflamed and may even show superficial ulceration or hyperkeratosis. So it is well-defined, slow-growing lesion. Histopath features. We can see a nodular mass of fibrous connective tissue which is covered by stratified squamous epithelium, and this epithelium is stretched. There is shortening or flattening or atrophy of the retipex. There is increased bulk of connective tissue seen. So your connective tissue is dense and collagenized. Bundles of interlacing collagen fibers are interspersed with varying number of fibroblasts or fibrocytes, and there are small blood vessels which can be seen. Collagen bundles may be arranged in radiating, circular, or haphazard fashion. So this is low power view. You can see thin stretched epithelium, and you can also see an exophytic nodular mass of dense fibrous connective tissue. Trauma to tissue causes vasodilatation, edema, inflammatory cell infiltration, which are mostly lymphocytes and plasma cells. Some cases, especially gingiva, you can see areas of diffuse or focal calcification or even ossifications. The surface may exhibit hyperkeratosis from secondary trauma. So this is your high power view. It shows the dense bundle of collagen fibers beneath the epithelial surface, and you can see this is thin stretched epithelium. So that's all for your lecture. Thank you.